Well, it seems like every time that you turn on the television, experts are talking about new guidelines for tests related to your health.
We're talking specifically about women's health, something that we don't really talk about in polite company, but it is important because over the last few years, and most recently just last month, new guidelines have come down from a government agency that stretch out when these tests should be taken. The confusion continues regarding mammograms and now pap smears, tests, of course, that are important to women. So I sat down with a gynecologist in Chesapeake to cut the confusion in today's What's Your Problem?
Miss Cromwell? Hello.
Every year, like clockwork, Deborah Cromwell finds herself at the doctor's office for a yearly checkup and the annual check-in on her health.
My health is, of course, extremely important to me. I like to know what's going on with my body. I'm very aware of changes that in my body, and I want to know that I'm healthy.
A government agency is weighing in, not on the annual visits themselves, but on what tests are carried out during them. The U.S. Preventative Services Task Force is now saying yearly pap tests, which are considered the best way to prevent cervical cancer, are not necessary, instead suggesting women get screened for the disease every 3 years instead of every year. It is confusing, and it flies in the face of what women have been told for years. So what is she supposed to do?
It's not a mandate. It is a guide, and that's just it. It's a guide. It's the basis for conversation.
Dr. Margie Corney is a Chesapeake gynecologist and says women shouldn't be making this kind of decision on their own anyway.
The point is that people are confused. And if you're confused, then you need to go to the authority.
Dr. Corney says some people simply don't need to screen for this type of cancer every year.
And the reason for this is because the probability of cervical cancer is not very high in certain people, and depending upon what their history is. So it's not cost effective to screen those particular patients every year because the yield is going to be low. For example, a patient that's had a hysterectomy, it's not necessary to do a pap smear on that patient on an annual basis. She has no cervix. I'd also like to add that there's a distinction between a pap smear and a pelvic exam. The pelvic examination, for most patients of reproductive age, it needs to be done on an annual basis because there are other things that can come up, other things that need to be evaluated, and it's an opportunity for the doctor to establish communication with the patient and maybe direct her in other ways. Keep in mind the pap smear is a screening test. It's not designed to clearly define or diagnose an abnormality. Its job is to try to get all the abnormalities, anything that could possibly be determined from a pap smear.
And that's the other thing. If pap smears are designed to identify all abnormalities, there's always the possibility a woman goes through emotional and physical stress for something that turns out not to be harmful. In 2009, the same government group presented new guidelines for mammograms, recommending against routine mammograms for women in their 40s. Dr. Corney says those new guidelines haven't changed what she tells her patients.
As of right now, your first mammogram should be at age 40. If you're high risk, then things might be different. It might be suggested that you do your mammogram even at 30. But right now, your mammogram should be started at age 40, and it should be done annually, and up until 50.
And that's Dr. Corney's final word. The guidelines may be changing, but they don't necessarily mean changes for you.
Relying on our own health experts is crucial.
So here's another change. This government group saying that girls under 21 don't need that yearly cervical cancer test either. Another discussion topic that you should be having with your doctor.
Some good information, good to lay down. Like you said, it's just a guide.
It is a guide, yeah.
All right, thank you, Cheryl.